Okay, so here is a quick comparison between spinal and general anesthesia. Post-operative cognitive effects are more in general anesthesia in older patients like delirium and post-operative cognitive dysfunction. Sedation may be still needed in spinal anesthesia. If sedation is given in older patient, it may be risky. So spinal anesthesia has some cardiac complications like there is hypotension and bradycardia due to sympathetic blockage, decreased myocardial perfusion pressure. So, given large amount of IV fluid in bolus form before performing spinal anesthesia is good to minimize the hypotension and bradycardia effects. In general anesthesia, most agents are cardiac depressant and vasodilation happens. Deep anesthesia causes hypotension. Light anesthesia causes hypertension and tachycardia. Both myocardial oxygen demand and perfusion are bad for coronary arterial diseases. So there are some of the uh, factors that you have to keep in the mind in order to select what type of anesthesia a doctor is going to perform. So obstetric patient epidural anesthesia is commonly preferred because of pain management and it is good for maternal saving maternal part and also morbidity. So mother remains awake and experience childbirth. This is advantage and very good thing for spinal anesthesia. It has low risk and pulmonary aspiration cannot happen, or less chances of failed intubation will be there. So uh, it is very important to uh, take the risk. Okay, so for spinal anesthesia, as you can see, these are some layers that are biased while doing spinal anesthesia. Now, first of all, comes outermost skin, which is outermost part, then subcutaneous fat, then there comes supraspinous ligament, interspinous ligament, and ligamentum flavum, in which after that there is dura and then subarachnoid space. So in this way, we have to perform and cross all these layers to perform a spinal anesthesia and place the medications in subarachnoid space in order to perform spinal anesthesia. So, in subarachnoid space, we inject bupivacaine, and according to surgery, we give dosage. There are certain factors that affect the uh, dosage that affect the all kind of aspects of spinal anesthesia. Some factors like veracity of the drug and site at which drug is injected. Commonly we inject at L3 L4 level, and we do saddle block in perineal surgeries, and we ask the patient to lie down supine if there is any surgery that is required to require the block below T10 level. So in this way we inject hyper or hypobaric solution, and we ask the patient to tilt the position in order to block the certain part of the body, certain part of the limb. Or so while injecting a spinal anesthetic agent, there are different fibers that are blocked, that are given in the table, like beta fibers are sympathetic fibers. They are small myelinated fibers. They are blocked for sympathetic blockage. A delta fibers are for pain and temperature. These are small myelinated fibers. And C fibers are for pain. A beta fibers are for touch and pressure, and A alpha fibers are for motor. These are large myelinated fibers. So these fibers block pain, touch, pressure, sympathetic activity, and also motor blockade. So these blockages results into different blockade sequence, and spinal anesthesia shows its effects.